You've got a bad cough, chest discomfort, maybe a fever, and your doctor says it could be pneumonia or bronchitis. But what's the difference between the two? They're both lung related and can be very similar, but they're not the same. Let's break it down. First, what is bronchitis? Bronchitis means inflammation of the bronchi, the larger airways that carry air from your windpipe into your lungs. When these airways get swollen and filled with mucus, it can become harder to breathe, and that's what causes coughing. There are two types: acute bronchitis, usually caused by a virus, like the common flu, or cold. It typically lasts a few days to a couple of weeks. Chronic bronchitis, a long-term condition that's part of chronic obstructive pulmonary disease, COPD, often caused by smoking or long-term lung irritation. Now, what is pneumonia? Pneumonia is an infection of the air sacs called alveoli, deep in your lungs. Instead of filling with air, these sacs fill with pus or fluid, which makes it much harder for your body to absorb oxygen. Pneumonia can be caused by bacteria, viruses, and fungi. It can range from mild to life-threatening, especially in infants, older adults, and people with chronic conditions. While both conditions can cause cough, fatigue, and chest discomfort, there are key differences. In bronchitis, the fever is mild or none, cough is persistent, the chest pain is mild, you have moderate shortness of breath, fatigue is present, and you will not hear crackling in the lungs. While with pneumonia, you often have a higher fever with chills, your cough can be dry or wet, you can have sharp pain that can worsen when breathing in the chest, shortness of breath, the fatigue is more intense, and you will hear crackling in the lungs. In order to diagnose this, doctors may use the stethoscope to listen to the lung sounds, a chest X-ray to check for fluid or infection, and a blood test to identify the cause. Bronchitis, especially if viral, usually goes away on its own. Treatment focuses on rest, fluids, and possibly inhalers. Pneumonia requires antibiotics. Severe cases may need hospitalization, oxygen, or IV fluids. So, what's the bottom line? Bronchitis affects your bronchial tubes. It's usually viral and less serious. Pneumonia affects your lung tissue and can be dangerous if untreated. If you have a cough that does not go away, especially with a fever, chest pain, or trouble breathing, don't guess, get checked. Knowing the difference could help you get the right treatment faster and breathe easier. You've got a bad cough, chest discomfort, maybe a fever, and your doctor says it could be pneumonia or bronchitis. But what's the difference between the two? They're both lung related and can be